Did you know that 99% of Americans fail to recognize the early warning signs of cancer? That's a staggering statistic. Cancer often starts silently, with symptoms so subtle that they're easy to overlook. But catching it early can make all the difference, dramatically improving treatment outcomes and survival rates. In this video, we're going to break down 8 critical early cancer signs that could literally save your life or the life of someone you love. Don't ignore the signals your body is sending. Let's get informed and stay healthy together. Alright, let's talk about unexplained weight loss. We're not talking about dropping a few pounds after a holiday feast. We're talking about a significant unintentional drop in weight like 10 pounds or more without any major changes in your diet or exercise routine. Now, I know what you might be thinking. Dr. Mike, losing weight is a good thing, right? Well, yes, in many cases, but not when it happens out of the blue and you can't explain it. This kind of sudden weight loss can be a red flag for certain types of cancers, like stomach, pancreas, lung, or esophageal cancer. Why is this a big deal? Well, cancer cells are greedy little buggers. They grow and multiply rapidly, consuming huge amounts of energy from your body. This can lead to a phenomenon called cancer cachexia, where your body starts breaking down muscle and fat for fuel, even if you're eating normally. So, if you notice the numbers on the scale steadily creeping down without any effort on your part, don't just brush it off as a lucky break. It's crucial to get checked out by a doctor to rule out any underlying medical conditions, including cancer. Remember, early detection is key when it comes to cancer. The sooner you catch it, the better your chances of successful treatment and recovery. So, pay attention to your body, and don't hesitate to seek medical advice if something feels off. Let's talk about fatigue. And I'm not talking about the kind you feel after a long day at work or a tough workout. I'm talking about persistent, unrelenting fatigue that just doesn't seem to go away, even after a good night's sleep. We all experience fatigue from time to time, but if you're constantly feeling drained, exhausted, and like you just don't have the energy to do the things you normally enjoy, it's time to pay attention. This kind of persistent fatigue can be a sign of several different health issues, including cancer. Now, I know fatigue is a very general symptom, and it can be caused by a lot of things. But when it comes to cancer, it's often one of the earliest signs. Cancers like leukemia, lymphoma, and colon cancer can all lead to persistent fatigue. Why does this happen? Well, cancer cells are like energy vampires. They're constantly multiplying and growing, sapping your body's resources and leaving you feeling depleted. Additionally, some cancers release substances that can interfere with your body's natural energy production, further contributing to fatigue. So, if you're experiencing persistent fatigue that's interfering with your daily life, don't just try to push through it. Talk to your doctor. They can help you figure out what's going on and get you the treatment you need. Let's talk about lumps and swelling. Now, I know this is a sensitive topic, but it's so important to be aware of the changes in your body and to know when to seek medical attention. Our bodies are constantly changing, and most lumps and bumps are harmless. But sometimes a lump or swelling can be an early sign of cancer. That's why it's crucial to be familiar with your body and to know what's normal for you. If you notice a new lump or swelling, especially one that's hard, irregular in shape, or doesn't move easily under your skin, it's important to get it checked out by a doctor. This is especially true for lumps in the breasts, testicles, lymph nodes, or anywhere else in the body. Early detection is key when it comes to cancer treatment. The earlier a cancer is found, the easier it is to treat, and the better the chances of survival. So don't hesitate to talk to your doctor about any lumps or swelling that you're concerned about. Chapter 4. Changes in skin or moles. Don't ignore the signs. Our skin is our largest organ, and it's constantly exposed to the elements. So it's no surprise that it can show signs of wear and tear over time. But it's important to be aware of any changes in your skin, especially new or changing moles, as these can be early signs of skin cancer. Now, most moles are harmless, but it's important to know what to look for. A mole that's changing in size, shape, or color, or a new mole that appears after the age of 25 should be checked by a dermatologist. Another thing to watch for is any sores that don't heal, or that heal and then come back. These can also be signs of skin cancer. Skin cancer is the most common type of cancer in the United States, but it's also one of the most preventable. Protecting your skin from the sun's harmful UV rays is the best way to reduce your risk of developing skin cancer. So be sure to wear sunscreen with an SPF of 30 or higher every day, even on cloudy days. And if you notice any changes in your skin, don't hesitate to see a dermatologist. Chapter 5. Persistent cough or hoarseness, when to be concerned. We all get coughs and colds from time to time, and usually they clear up within a week or two. But if you have a cough that lingers for more than 3 weeks, or a hoarse voice that just won't quit, it's important to see your doctor. A persistent cough or hoarseness can be a sign of several different conditions, including acid reflux, allergies, or even a viral infection. But in some cases, it can also be a sign of something more serious, like lung cancer or throat cancer. Now, I know it can be scary to think about, but it's important to remember that early detection is key when it comes to cancer. The earlier it's caught, the easier it is to treat. So if you have a cough that's been hanging around for a while, or if you're experiencing hoarseness that doesn't seem to be going away, don't ignore it. Make an appointment with your doctor to get it checked out. Chapter 6. Pain is our body's way of telling us that something's wrong. It's a natural response to injury or illness, and it's usually temporary. But what about pain that lingers for weeks or even months without any obvious cause? If you're experiencing persistent pain, especially pain that's severe, doesn't respond to over-the-counter pain relievers, or is accompanied by other symptoms like fever, weight loss, or fatigue, it's important to see your doctor. Persistent pain can be a sign of a wide range of conditions, including arthritis, fibromyalgia, and even cancer. In some cases, pain may be the first noticeable symptom of cancer, especially cancers that affect the bones, liver, or pancreas. Now, I know it can be easy to dismiss pain, especially if it comes and goes or isn't severe, but it's important to listen to your body and to seek medical attention if you're concerned. Chapter 7. Our bodies are pretty amazing, but sometimes they do things that can be, well, a little alarming, like unusual bleeding or discharge. Now, I know this can be a little bit of a TMI topic, but it's important to talk about because it could be a sign of something serious. Bleeding or discharge from any part of your body that's not normal for you should always be checked out by a doctor. This includes blood in your urine or stool, unusual vaginal bleeding or discharge, bleeding from the gums, or coughing up blood. There are many potential causes of unusual bleeding or discharge, some more serious than others. It could be something as simple as a minor infection or irritation, or it could be a sign of a more serious condition like cancer. For example, blood in the stool could be a sign of colon cancer, while unusual vaginal bleeding could be a sign of cervical cancer, and coughing up blood could be a sign of lung cancer. Chapter 8. Let's talk about something we all do, but don't always like to talk about. Going to the bathroom. Specifically, changes in your bowel or bladder habits. Now, I know this might not be the most glamorous topic, but it's important because these changes can sometimes be a sign of something more serious, like cancer. Our bowel and bladder habits can vary depending on our diet, stress levels, and even medications we're taking. But if you notice any sudden or persistent changes in your bowel or bladder habits, it's important to talk to your doctor. For example, if you're experiencing constipation, diarrhea, or changes in the consistency of your stool that last for more than a few days, it could be a sign of colon cancer. And if you're having to urinate more frequently, experiencing pain or burning during urination, or seeing blood in your urine, it could be a sign of bladder cancer. Now, I don't want to alarm anyone, but it's important to be aware of these potential warning signs and to seek medical attention if you're experiencing any of them. Outro. So there you have it. The 8 early cancer signs you should never ignore. Remember, knowledge is power, and being proactive about your health could save your life. Don't wait until it's too late. If you experience one or more of these symptoms for more than a few weeks, please seek medical attention. Early detection is key to successful treatment and recovery. Get screened regularly for cancers like breast, prostate, and colon. These screenings can detect issues before symptoms even appear, giving you the best chance at a positive outcome. Trust your gut. You know your body better than anyone. If something feels off, don't ignore it.